Okay, so welcome everybody. Welcome everybody to this session, which we name as the Making an Impact Through Biomedical Engineering. So this session is going to be chaired by the Department of Biomedical Engineering. So today we have three speakers, including myself. So I'll be chairing the whole session. So I'm Prof. Po. So I'm also the graduate program director. So first of all, I'm going to give an introduction to BME and then share a bit more about our Master of Science program. And following my presentation, we have Dr. Mark Chong. He's a senior lecturer in our department. He's going to share with us, a very exciting module, called the Biodesign, right? To share with you, what we do in that particular module. And then following on, we have Singla. So Singla is actually our NUS PhD student in our department. He's actually a current student. So we invited him to share to you guys, some of the experience that he has at NUS, including taking the modules or his student life at NUS, right? Then we'll end off the whole session with a Q&A, to answer any question that you might have, all right? So without further ado, so let me begin. So, I'm just going to give a quick introduction to biomedical engineering and the Masters of Science program. I'm not sure what you know about biomedical engineering. Do you recognize any of this technology that I've shown over here? It's quite a list of them. Maybe you might recognize one or two. Ultrasound, does that sound familiar to any one of you? Robotics, diagnostics, right? Biomechanics. There's actually quite a wide range of technology that I'm showing here, right? And then usually you'll see them in the healthcare institution like the hospital. So essentially, what is biomedical engineering? So it's a discipline where we apply engineering principles and design concept to medicine and biology. So we use this in the healthcare industry, pretty much for the healthcare purposes, right? So we are looking at diagnostics, right? We also look at therapeutics, including helping patients to recover, right? So we do a range of innovation, for the healthcare purposes. So you might be wondering, is there really a demand for biomedical engineering? I would say yes. In fact, the demand is growing, right? And it's growing rapidly. Not just about trying to tackle, what we're experiencing right now in the pandemic, but also healthcare issue that we are facing in our aging population, right? You can imagine, the type of care, the type of treatment that we need to really facilitate, the daily life of our elderly, right? So in that context, biomedical engineers actually play a very critical role. As you can imagine, this healthcare sector is expanding. So we need more biomedical engineers to really support this particular sector. And at NUS BME, we have extensive experience in training biomedical engineers, both at the undergraduate level and at the graduate level. So what I'm sharing today is mainly more at the graduate level. So, let me now give a little bit overview about our MSc program, which we just launched this year. So the first batch is actually starting August, this year. So what is this program about? So essentially, students go through this program, complete a number of coursework, and then the students can graduate with a Masters of Science degree, right? So student can choose to do it as a full-time student or a part-time student. So if students choose to do full-time, they have 1 to 2 years to complete the modules that they need to take. Or if they choose to do part-time, they will have 2 to 4 years to complete, right? So to successfully complete the program, the students need to complete 40 modular credit module. So we call that MC, right? So essentially, each module will have 4 MCs. So that equates to 10 modules that the students needs to complete, right? So out of this 10 module, the student needs to complete 2 core and then 8 electives. So essentially, 2 modules are sort of what the student needs to do, and then 8 electives the student can choose from a list of elective modules that we have sort of selected in the basket, right? So the students have right now 15 different electives to choose from, right? And every year we will have 2 intakes of students. So one in August, as I mentioned, and then we have another one in January. In fact, we are starting to recruit or open up our admission for the January intake next year, right? And you might be wondering about the tuition fee. So for the MSc program, the tuition fee is per program. What that means is that it doesn't depend on the duration. So if a student chooses to finish the program in 2 years, he will pay the same fee as the students who finish the whole program in a year, right? So it's not tied to like how many semesters you take to finish the program. Okay, so the fee is actually based on per program. And for this current intake, the tuition fee is 40,000 Singapore dollars, right? And moving forward to next year, this tuition fee might change, right? Depending on the situation, the demand and things like that, right? But as per now, the tuition fee for the coming January intake, will be 40,000 excluding GST, right? So this is kind of like a brief overview about the MSc program. And you might be wondering, why should you study at NUS? So these are 9 good reasons that, to convince you that NUS is actually a very, very good place to study, right? First of all, we are highly ranked, right? In fact, NUS is Asia #1. We have excellent history of teaching academics, right? We have accomplished faculties. If you have a chance to come to NUS or you have been to NUS, you'll realize that we have world-class campus and facility. We work very closely with the industry. We have very strong ties with the industry, and that helps our graduate to get employed. We have very good reputation with the companies. Right. And last but not least, we are also committed beyond academics. We support lifelong learning. We are committed to train, or continue to train our graduate, in their lifelong journey, right, in their work life, right? So, these are some reasons that why I think you should come to NUS to study. And what can the program do for you? So essentially, we have structured the program in 4 key areas. So firstly, we enable you to develop the system and design thinking skill, particularly in the medical technology area. And secondly is to develop your transferable soft skill. Those soft skills that you need to interface with your management, with the clinician, nurses, healthcare workers, including other engineers as well, right? And we also will prepare you to work effectively in this very multidisciplinary environment, like in the hospital or even in the companies where you have to interact with different people, right? And last but not least, really to train you to learn how to apply the technical skills or knowledge that you pick up in the program, and to apply that in the industry, essentially to apply that to your work, right? So that you can excel, in your career. So these are 4 key areas that the program will focus on in training you. In terms of career prospect, you might be wondering, right? So our graduate actually been employed in many areas, and these are 4 key areas over here. So students, they have been employed in the healthcare and research industry. They work in a hospital or in research institution. At the same time, they can work with companies that deal with medical technology. We have 3M, Medtronics, GE Healthcare. I'm pretty sure you might know some of this. So our students are also being employed in pharmaceutical and biotechnology. And one of the very big employer of our students is actually Illumina. Have you heard about Illumina? They provide very high throughput DNA sequencing technology. And that is very important when it comes to sequencing of viruses or bacteria in the healthcare industry, right? And then we also have students being employed in startups. In fact, our faculties are very active in starting up companies. What I've shown over here, these are actually companies set up by our faculties. And if you come over and join us, you're actually being trained by faculties who are not just excellent in teaching, they're also very active in entrepreneurship, in setting up companies based on the research that they are doing at NUS, right? So it's a really good environment for you to get trained. And in terms of the highlights of the program, so we structured the curriculum around these 6 key areas in biomedical engineering, where we see demands and importance, right? So we look at in the curriculum, we have topics on medical imaging, signal processing. We have this very hot topic on robotics, right? And we also talk about clinical instrumentation, regulatory, and biodesign and innovation. So Dr. Mark Chong is going to talk more about this biodesign, right? And last but not least, this very important and very rapidly growing area, which is digital medicine, right? So this gives you a snapshot of the key sort of areas that you will learn by taking up this MSc program. So what I'm showing here are 4 modules that we are offering, and these are very sort of important areas. So if you can come, you will have a chance to study these modules, right? So we have modules on biosensors and biochips, digital healthcare and medicine, and also tissue engineering, in terms of how we grow tissues to do treatment. As per how to apply for our program, we have 2 application period every year. So as I mentioned, we are taking in the January intake, and the admission should be open sometime in July, so which is next month, right? And then for the August intake, it will be in December to sometime in March, right? So keep a lookout for this application period if you're interested to apply, right? And if you're interested to find out more, scan this QR code. It will lead you to our department MSc program website. There you'll find a lot more information, like what are the modules that we actually offer, including the admission requirements, right, for the MSc. So yeah, not going to take up too much time. So if you guys have any question about the program, so there's an email address over here, and feel free to drop us an email. And if you are using WeChat, you can also scan this WeChat QR code to join us on our group, right, to share with us any of the questions that you have. Right, so with this, I'm going to stop, right? So I'm going to pass the presentation to Dr. Mark, right? Then he will carry on. So we will then answer question after Sing Lei present, all right? So with that, Mark, I'll pass to you.
Okay, thanks, Trilo. So yeah, guys, well, I'll try to keep it short because I want to have more time for Q&A. But in the meantime, I don't know if everybody can just do me a favor in the chat group, in the chat window, if you can just drop a short message saying, which discipline you're from, just as a quick, out of curiosity, just quick poll for me to understand you a bit better.
That's good. Right? Yeah, that's good. Just type anything.
Yeah. So yeah, and if you can just let me know where what's your first degree was in. Were you from mechanical engineering, electrical engineering, bioengineering, biomedical engineering? Well, just say hi on the chat. Yeah. Okay. But anyway, let me quickly get started. Yeah, thanks again, Trelu, for the introduction. My name is Mark, and like what Prof. Paul was mentioning just now, I'll be teaching this course called Biodesign, right? And before I actually go into, thanks, Ryan. So before I go into the actual, what biodesign is, I'm going to, carry on a bit from where Prof. Paul was mentioning about what biomedical engineering is. And perhaps one thing is that I'm hoping to convince you that, we are not just another branch of mechanical engineering or not just another branch of electrical engineering, right? Because as biomedical engineers, what really sets us apart is that we deal with products in the health and biomedical sector, right? Almost exclusively. As compared to, say, for example, if you are in mechanical engineering, and yes, you may be, dealing with some form of robotics, for example, But very few people, very few mechanical engineers who have the opportunity to delve deeper, right, into this health and biomedical sector that we are in. All right. So what do I mean by products in the health and biomedical sector? If you look at this image on your right, I put out a Venn diagram that kind of breaks it up into products, including pharmaceuticals, which are drugs. So things like paracetamol, cetirizine, Panadol kind of thing, right? Moving to the right, you have biotech, and it's something that we are very much more familiar with nowadays, right? Especially when we talk about vaccines and we talk about mRNA vaccines even, right? But also immunotherapy and cellular therapeutics. Well, that's very much in biotech. When you move to the bottom of this Venn diagram, you read that there's medtech. So medtech refers to anything that's primarily physical in its interaction. So anything that relies mostly on principles of physics, right? Like things like X-rays, all the way through to wheelchairs, syringes and needles, heart stents, and the like, right? So those are medical devices that fall within medtech. And when you move to the left, you see that I talked about digital products, right? Digital health products. So these include things like fitness monitors, your smartphone apps, but all the way through to things like AI, various types of programs, various types of digital products that can help in guiding clinical decisions, or even to achieve some form of digital therapeutics as well, right? So hopefully that helps you to understand a bit better about this playground that we play in, right? And that's what sets us aside from the other engineers really is the context that we are dealing with, right? So you might find there's overlap in contents, right? We might teach certain things which overlap, like mechanics, like circuit design, and so on and so forth. But the context is really unique. And I can't just give you 101 on how a doctor thinks, or I can't just give you a 101 how a hospital operates, right? So the best way really is to get you guys to work on projects, right? So the way that I try to get you guys to work on projects is to work with clinicians to solve real problems. And in the process, in your interactions with them, in the process of evaluating possible solutions, you will get to develop a much better understanding of what is it that they are, what defines or what makes this health and biomedical sector so special, right? And it's don't worry, I'm not just going to throw you a problem and tell you, hey, go and cure cancer, right? It doesn't work that way. There's a very good, robust framework, which is based on what is called a biodesign process of innovation, developed in Stanford, and is something that we've adapted and adopted in Singapore. So biodesign really runs innovators through processes of identify, invent, and implement. And I'll talk about it a bit more in a while, right? But how it all begins is that we have a clinical need, right? So like I was mentioning, we get the clinicians provide some problems. So in this picture, basically I have some students working by ophthalmologists who has this problem with slit eye. Not problem in the sense that he wants these guys to fix it, right? But he is saying that there's some limitations to this existing device. And he's hoping that the engineers will come in to give him some innovations to solve some bigger problems for him, right? So it's, don't get me wrong, I'm not sending my students there to repair the scope for him. Is to understand the problems that he's facing in clinics in order to come up with a real innovation that can address these problems, right? So this is part of the need specification process, whereby they actually have to figure out and understand, right? So if the problem has to do with diagnosing problems of the eye, then you have to understand the anatomy of the eye. You have to understand pathophysiology of the disease. You have to understand how the patient is treated. What are the options which are available, right? And in so doing, you get a much better appreciation of the problem. And this allows you to come up with very innovative and very targeted kind of solutions using what we call brainstorming and ideation techniques, right? And of course, you can come up with 10,000 different ideas. But the next step where I guide you guys to is to try to understand, hey, what's so strong about this solution, right? Yes, you can build a prototype, you can build a device, but besides that, have you thought about what are the intellectual property considerations, what are the patents that are needed? Have you thought about what's regulatory processes? What is it that the government requires you to demonstrate in order to sell this device, right? So on and so forth. So after all this, you get a much better, much more thorough understanding of the healthcare system, right? If you don't mind, I'll just very quickly show this video to kind of summarize what I was mentioning earlier. What comes to mind when you hear about innovations in medicine? Connected devices, sophisticated machines, or some kind of science fiction technology? But wait, hang on there. Don't you think we should start the process of innovation by first thinking about the need? In Biodesign, that's exactly what we do. By bringing innovators through the phases of identify, invent, and implement, we teach the process of innovating health technologies using a need-centric approach. During the identify phase, we immerse ourselves in clinical settings in order to find needs, and subsequently conduct extensive research in order to thoroughly understand them. Moving on to the invent phase, we brainstorm, generate creative ideas, and then critically evaluate each one in order to identify the top concept. This we bring to the implement stage, where we develop go-to-market strategies that will give our product the best chance of success. That's it. Biodesign is a needs-based framework for innovations in health technologies, entailing and identify, invent, and implement, and improves the chances of having a successful product. For more information, visit the site at ebiodesign.org. All right, so I hope that's gave you a better understanding. Effectively, how I run you guys through this process is over 13 weeks, I try to lead you through the identify and invent phases. And of course, it's not just me, right? The great thing about working in NUS is that I'm surrounded by brilliant colleagues. So we get access to experts in design such as Dr. Bina Rai, experts in product development such as Dr. Ali. We've also got access to experts in IP such as Professor Casey Chan, as well as experts in regulatory affairs and prototyping such as Professor Liu over here, right? So the whole point is to amalgamate all this collective experience using this Biodesign framework that allows you to work through these projects and in the process really learn about this health and biomedical sector that we are in. All right. So without too much further ado, I think I'll call close to my section. But I hope you'll be impressed enough to really consider joining us. And I really look forward to seeing you in our master's program. All right. Happy to take any questions if there are. Yeah. Thank you.
So thank you so much, Mark. Yeah. So if any one of you have any question, feel free to type in the chat in the meantime. So we'll move on to Xinlei first, right? And then later we can have a discussion over the Q&A. Thank you so much, Mark. So Xinlei, to you.
Yeah, guess it's screen.
Yes.
Yeah. Yeah. Okay. So, hello everyone. My name is Xinlei. I'm currently a year 1 PhD student from the BME department. I know some of you are planning or preparing to apply a graduate program in NUS, so I'm glad to be here to share some of my experience. The contents will involve some topics you may care about, such as the campus life, course study, and research work. So, okay, so the BME department is located in NUS Cambridge campus, which is in the west of Singapore. So most of the courses are offered here. First, I will introduce the on-campus living. To saving your commuting time and living costs, you are recommended to apply an on-campus accommodation. It can be found in University Town, Prince George's Park Residence, and Ridgeview Residential College. There are multiple types of accommodation available. Most students living on campus are in their early 20s. Ratio have different majors, with a good mix of local and international nationality. And some interesting activities will be held by the cluster leaders or residential assistant for helping you get suitable to the new environment. In respective accommodation, there is also a dedicated team during office hours for management of facilities, providing advice on housing rules, and offering any other assistance for you. Amenities and services ranging from the food courts, sporting arena, pharmacy, and many more essential facilities are located around campus, so making the life on campus convenient for students. There are canteens near different colleges of NUS, and there are also lots of really great food places at NUS hostels, as mentioned before. You can find different flavors from different countries here. And also the warm climate in Singapore makes it suitable for multiple kinds of outdoor sports, except for a few that requires booking in advance. Almost all the professional sports fields, such as the basketball and football and swimming pools, are open to students free of charge. And using your student card, you can also have free access to the gym. There are many bus lines and bus stops in NUS. You can easily get anywhere by taking the NUS school bus. NUS is also well connected by the public transport via trains and buses. For example, the Kent Ridge MRT station near the NUH. In addition to NUH, you can visit the University Health Center when you're feeling uncomfortable. So you can read and borrow books in multiple NUS libraries, including the Central Library and Chinese Library. You can also search for some online resources from the NUS library portal, and you can find some journals and scientific readings there. Next, I will share some academic courses for graduate students offered by BME department. I will introduce 4 modules, but not limited. So, for example, this module is designed to make students acquire knowledge related to the design, construction, and clinical testing of biomedical electronics and instrumentation for electrophysiological acquisition from the body. The major topics covered include the fundamentals of clinical instrumentation, including ultrasound, CT, MRI, PET or SPECT, and optical coherence tomography. If you want to know more, this module covers the physics and technology of different medical imaging, topics that are important to developing a comprehensive understanding of medical imaging technology, such as the detectors, imaging forming processes, tomographic reconstruction methods, and the clinical applications. They comprise an important proportion of this module. If you are interested in small devices that can be individually monitored and generally used for the analysis of multiple molecular analyses, you can choose this module. There are 3 main topics of this course: optical, electrical, and living sensors. Microfluidics was also one of the topics simply covered. You will also learn about the numerous applications of these sensors in a variety of settings, not limited to biomedicine. Okay, so if you can choose the BN6401 if you are desired about the optical bioimaging technique and has a prior familiarity with microscopy. This module focuses on advanced techniques in fluorescence microscopy for quantitative measurements within cells, tissues, or molecular systems. The topics cover the single molecule fluorescence, super resolution microscopy, the optical and instrumentation issues in advanced fluorescence microscopy, and the recent applications of these techniques. Okay, so as a graduate student, if you are applying a research-based program, the research work is also an essential part of your campus life. In BME department, there are a lot of interesting topics for your selection, but the most important feature involves the development and integration of multiple new technologies. So you will have an opportunity of working closely with a professional NUS or overseas engineers, biologists, physicists, chemists, doctors, and pathologists, and so on. So the BME department will provide sufficient funding and well-trained faculty members to help you to start your research career. Yeah, that's all for me. Thank you.
So thank you so much, Singlet. So I just want to add to what Singlet mentioned about research. So although the MSc program is mainly a coursework-based program, but we do have a module where students can actually sign up to do research for a semester, right? So in that context, the students can actually contact the BME faculty of doing a research area of their interest, and very likely the faculty will take you through that whole research process, right? Just to make a comment, although the MSc is really a coursework. All right, so now we are in the Q&A session. Right. So yeah, we're open to answer any of the questions that you might have. Now you can feel free to type your question in the chat, and because I don't see many people here, in fact, if you want, I don't know whether you can unmute and just ask us any question, right, that you might have. Any one of you are already interested in looking at biomedical engineering, or are you wondering what sort of a degree is relevant for biomedical engineering? Oh, so there's a question. Oh, it's a 40K, 40. So there's a question in the chat about the fee, right? Sorry that wasn't clear. So yeah, the tuition fee is 40K, 40,000, okay, per program, and that excludes the GST. So just now I've showed you guys the very nice picture of a new building, of our new BME building. It's just been launched, right? So if you sign up and then you take the modules with us, that's where you will be learning, and that's where the lessons will be conducted. Okay, there's another question. Let me read out the question. All right. So what kind of student background are you looking at? Biomedical engineering, or can it be any STEM background, working experience needed? Right. So to us, if you have an engineering degree, you're welcome to sign up for our MSc program. It can be mechanical engineering, it can be chemical engineering, it can be even environmental engineering, right? So we welcome students with engineering background to sign up, right? Now, even if you have more sort of a life science background, maybe you did more on the biotechnology, we still welcome you to apply. We'll still look at your transcript, look at the modules that you have taken. If you have suitable modules that so we think that you can cope with the MSc program, we will still admit you, right? And for example, if you have a long working experience or some working experience in the biomedical engineering, yeah, we look into that as well, right? So that will be viewed as supporting you joining us, right, in doing our MSc program. Alvin, I hope that answered your question. So Alvin, may I know what background do you have?
Perhaps, there we go. Oh, but anyway, I suppose perhaps while Alvin is typing in his undergrad background, I think I just want to highlight what Prof. Paul was just mentioning just now, right? The rationale really is that we are helping to see whether or not you are likely to cope well with the course, or whether or not you struggle, right? So yeah, I think it's what's the best thing you can do if you are really interested in the program is to just apply anyway, and then let's have a chat, to help you to see whether or not it makes sense for you, right? Yeah, I probably shouldn't be committing both Prof. Paul and Alicia to this, but we are all very open to having chats to find out a bit more, to help you to find to make sure that you're a good fit for the program.
Yeah. So yeah, don't hesitate to email us. So maybe I can share the link to the email address again. right? Just take note of this email address, right? And then yeah, just drop us if you have any question, right?
Yeah. So Trilo, I think Alvin has also just updated on the question and he was mentioning about food science.
I see.
I think the best thing really is to just have a chat lah. Then we can probably advise better. I don't think we should have a blanket, if you major in humanities then cannot, kind of thing, right? I think we should have a chat to find out, how best suited you for any program.
Yep, that's right. Yeah, if you are unclear, just drop us an email. We are always happy to talk to you.
Sorry to interrupt. I think the QR code in the picture has already expired.
Oh,
so
expired
feel free,
already.
feel free to screenshot my email address in the on the screen, and then you can reach out. I will send you an updated QR code if you would like to join our biomedical WeChat group.
Yeah, thanks, Alicia. Yeah, so take note of the email. I think that's where you can reach us. So maybe we can just take one more minute, right? We are coming to 5:40. Anyone has any other question? So as I said, you should be able to get a lot of information from our MSc website, right? Which I showed earlier. I think I have the website. So this is to our department website, right? You'll get a lot of more information, right? And Alicia has also typed in the email address on the chat. Okay, so if there's no further question, I hope we have convinced you that biomedical engineering is really an important area, and then biomedical engineers demand, and we are very keen to train biomedical engineers for the industry, and hope you'll be joining us, right? So maybe Mark, do you want to say any words to conclude?
Not much. Just exactly like what I said, and looking forward to see you guys in January.
All right. So with that, I will conclude the session. Thank you everyone to joining us for this session on biomedical engineering.
Trilo, sorry, there's a question all of a sudden in the chat.
Yeah, Kai Sing, right? Yeah, feel free, Kai Sing, to stay behind, right? Oh, so your question is if you want to apply a PhD in biomedical engineering with a coursework master, is this possible? I would say yes, right? So to apply for a PhD, usually what you need to look for is the supervisor. You need to look for the professor that's willing to take you as a PhD student, right? Then at the same time, right? So usually we encourage the students to look for scholarship. So usually when you approach the supervisor will usually talk to you and then help you to look for a scholarship. All right. But then based on what you mentioned, with a degree, with a master in MSE, right? You should be able to apply for a PhD. But what is your undergraduate degree? Okay. Yep, that's fine. Yep. So if you are keen to apply for a PhD, I would suggest look for a professor.
Yeah. So Trilo, I suppose is the MSc is almost like a nice way of having a preview, right, of the environment, before you commit straight away to a PhD.
Exactly.
And at the same time, the credits can be transferred, right?
Yes,
the PhD.
Can. Yep. Yeah. So the PhD, the students also need to complete a few modules, right? So if they have taken the Masters of Science in BME, some of the modules can be transferred. So they essentially take less module during the PhD, right? And we also have students who actually just want to test water, like what you said, right? So they're not sure whether they want to do a PhD, right? So they sign up to do a Masters of Science, and then at the same time they try to do some research to see whether they doing a PhD is actually what they want.
Yeah, both the course as well as the environment, not just NUS, and a chance to see Singapore and see whether you like it before you commit 5 years at a time, right?
Yep, that's right. Yeah, so to me is that several paths towards doing a PhD eventually. Yeah, I still see some of you are around here. Oh, we start seeing questions. So what's the difference between MSc and MEng from Larry? Right, so MSc is the Masters of Science and MEng is Master of Engineering. So MSc is based on coursework, as I mentioned. So student taking an MSc needs to take 10 modules. Right. As for Masters of Engineering is what we call research-based master. So students who take up Masters of Engineering, they spend most of the time doing research. So in terms of coursework, they just need to complete 4 modules. Right. But then they have to submit a thesis at the end of their program to successfully complete their MEng program. But for MSc, the students, they don't need to submit a thesis, right? What they need is to clear the 10 modules, okay? That's the key difference. But as I mentioned, for MSc, if students also wants to experience some research, we do have modules that students can actually sign up to. We call it the independent study, right? And so that the students will have opportunity to do some degree of research. Not as extensive as Masters of Engineering, but the students still be able to work under a professor and then do some research of interest. Right, Larry? I hope that explains the difference.
Yeah, so Trilo, I think this part is also a bit confusing. It's like, why are there so many different types of masters? I mean, the besides the form of it, I suppose it's what you intend to do with the masters, and also your own, your limitations, right? Okay, your limitations, as in your work requirements. Sometimes pursuing masters in engineering may not be as straightforward in that you need to commit you may have to commit a lot more time, or the schedules are not as flexible. So I think it's different purposes for different people. Depends on what you want to use it for.
Yeah, that's right. It really depends on you to see where your interest lies, right? And another difference between MSc and MEng is that MSc you can complete in 1 year, right? And for MEng typically is 1.5 years to 2 years, right? Because you are doing a lot more research, right? Okay, I just saw the notice that the room will close 5:50 sharp, right? So we can still hang in here for 2 more minutes. Does anyone still have any questions? If not, no, let's close this session before they kick us out. Right. So thank you, everybody. Have a good evening.
All right. Thank you.
Right. Bye.
Have a good evening, everyone. Bye-bye.